This is my audience for the night. And today I will be talking to you on the topic of medical marijuana. The U.S. is slowly coming to the conclusion that marijuana does have certain medical properties that help with a cornucopia of ailments. When I was 9, my grandmother died of multiple sclerosis complications. A couple of years later, when I was 15, I saw a medical report show, and the topic was medical marijuana. And there was this woman on there who had MS and was told she would lose her ability to walk. After consultation with a doctor that specialized in medical marijuana, he recommended a spray that had THC in it and would help counter the MS taking her ability to walk away. After reading more into how medical marijuana could be a better alternative to pills, I've had a fascination with the topic. So with that being said, let me explain some of the facts and research behind medical marijuana. The two active chemicals in marijuana is THC and CBD. CBD is a group of compounds called cannabinoids. It occurs in the glandular hairs of cannabis sativa and consequently in hashish, which is an extract of marijuana. It is non-psychoactive, that means it doesn't get you high. And it has many pharmacological effects, such as anticonvulsive, sedative, hypnotic, antipsychotic, anti-nausea, and anti-inflammatory. THC is the main psychoactive ingredient in marijuana. Depending on the type of strain, either THC or cannabinol is the most prominent cannabinoid in marijuana. The effects of THC are psychoactive, which means that gets you high. There are many different strains of marijuana, but the two subspecies include indica and sativa. Indica strains relax the muscles and acts as a painkiller. Sativa creates more of a euphoric high that lifts moods and relieves stress. The chemical that gives marijuana its medical effects are called cannabinoids. Studies have shown that medical marijuana does have certain medical properties, such as helping with severe nausea, vomiting, weight loss seen in patients with HIV and cancer, and patients with pain syndrome and muscle spasticity with multiple sclerosis. It can also treat glaucoma and help prevent Alzheimer's disease. It can be taken in several different forms, such as eating it, smoking it, applying it as oil, infusing it into foods, and drinking it. Various studies have been conducted to try to test the theory that medical marijuana does in fact help with a series of medical illnesses. The University of California Center for Medical Cannabis Research tested the short-term effects of medical marijuana, of smoked cannabis for neuropathic pain. 2 trials include HIV patients who had peripheral neuropathy. Results show that cannabis greatly reduced pain intensity. Research for oral intake of synthetic THC, dronabinol, and spasticity has focused on neuropathic pain and spasticity seen in patients with MS. Trials suggest that dronabinol significantly reduces the pain. Due to the THC, cannabis sativa is able to increase heart rate, enlarge and relax bronchial passages, and numb out pain. It is also known to help with migraine headaches. There is no documentation of a marijuana overdose. 75 autopsies are performed per year of people who were high on marijuana at the time of death. They died, but no harm from marijuana was ever the cause of death. But this experimental medicine isn't without its complications. Risks include increased developing of lung infections, lung cancer, coughing, and obstruction of air passageways. Long-term effects of marijuana may lead to short-term memory loss and other side effects that have yet to be tested and understood. Today, more and more people are pushing for the legalization of cannabis for these specific reasons. Although our federal government insists that the growth and possession of and use of medical marijuana is illegal, the evidence, research, and facts show that medical marijuana have positive effects medically and that has allowed it to become legalized in more states today. In conclusion, medical marijuana has come a long way from the novelty medicine it was considered. Thank you.